Hi, good afternoon everyone. This is Dr. Sanjay. Again, good afternoon from the call doctor. We are again here with a live session about hypertension. So, what I'm talking about hypertension, I think everybody knows about it. What is hypertension? Hypertension and why it's important. We will discuss something what are the common causes and how it affects our health and why it's important for us to know. Because everybody knows someone or they have blood pressure. So why it is important to know the blood pressure? Because blood pressure or hypertension is a very common illness. It's one of the common illness, like say around 1.2 billion people worldwide are affected through this hypertension. But of the people who are affected, only 46% of the people they are aware that they have a blood pressure. Because most, as you know, the blood pressure or hypertension is known as a silent killer. Because most of the people sometimes they don't check the blood pressure because they don't have any symptom. So, and of the patient who are know that they have a blood pressure, only 42% of those patients who know they have blood pressure, they take treatment. So you can understand the gap and why people always keep talking about reminding you another way. Hypertension Day is celebrated on 17 May just to remind people that hypertension is a illness and we need to control it. And why we need to control it, we'll let you know. I'll talk to you about what are the harm effect of not controlling it properly and what are the small simple steps that we can do that will help us to control it before we go to the doctor. Say, as I told you, that 42% of the people who know hypertension, they take treatment. And so then understand, if only 42% of the people take, and how many are actually controlled. They said the data says out of the 5 people who are taking medicine, only 1% they know how to, they are fully controlled as the target set by the World Health Guidelines, WHO or European Health Society. There are different guidelines. They come to one conclusion and how much is blood pressure control. So you can understand how much gravity. Only say around 50% of the people know that they have the blood pressure. Out of those 50% of the people who know they have a blood pressure, 50% take the medicine. Or out of the 50% people who take the medicine, only 20% people are fully controlled. Then you can understand why we have so many problems, in spite of that everybody knows the blood pressure is a problem, and everybody, they have now so many portable devices are available for everyone that they can check the blood pressure. It is a very simple device, not very costly also, and anyone can use it and monitor his blood pressure. So how to say that I have a blood pressure, like for a common man, when he should contact and what you should do. There are like few guidelines. They said blood pressure, how will you categorize blood pressure? There is a normal range, and everybody know the best range which is supposed to be, the blood pressure should be less than 120. There normally, there is two reading, people say 120 80, 120 30, 140 80, 170. So the upper one should be less than 120 and the lower pressure, which is called diastolic blood pressure, should be less than 80. That is the ideal blood pressure. But there is there is always, we give you gap or this. If your blood pressure between 120 and 139 or 80 to 89, this is called your normal range, or you have said if it is more than that, around in this range, you are more risk of having a high blood pressure. So the ideal is less than 120 systolic and diastolic less than 80. And your risk, or you need to monitor, is when the blood pressure is between 120 and 139 and 80 and 89. When you say blood pressure is mild, and then you classify blood pressure upon mild, moderate and severe. Mild blood pressure means your blood pressure is somewhere between 140 and 159, systolic one, and the diastolic one, the lower one, is 90 to 99. and it's moderate when it is 170, 160 to 179, and same like 100 to 109. This is called moderate. See, sometimes people with mild hypertension can be managed with lifestyle changes. What are the lifestyle changes? I'll tell you later on. So knowing your blood pressure, what it is, and when I should be aware, and that is very important. And severe is when blood pressure is more than 180 and systolic more than 180 and diastolic more than 110. See, most of the people who blood pressure is 180 and 110, they should immediately see the doctor and start treatment, because this is the pressure which now cannot be controlled, except sometimes there is isolated blood pressure because of stress. But you should, if it is constantly it's coming up, the best you should see your doctor. And for doctor, it's very important, they will evaluate depending on your age. He need to see what are the things which can lead to it. And so you understand now blood pressure and how many people are there not taking treatment and what is the category. And let's see the cause. Everybody says my father has a blood pressure, that's why I have a blood pressure. So family plays a very big role. People, it's almost run in the family. Say that's why I call what we call essential hypertension. 80 to 90% patient of blood pressure is essential hypertension. But in case of young, we need to evaluate. Suppose less than 40-year or 30-year age, you should see the doctor and he should do some tests. Normally they do tests to see is there any reason for it. So essential hypertension is normally with the age or it's run in the family. So what are the factors like run in the family? Another factors are which can lead to high blood pressure is smoking, stress, alcohol, obesity. Like people who are obese have a more tendency to have blood pressure, and some insulin resistance. Must be the people who are having metabolic resistance, metabolic syndrome. Metabolic syndrome is a combination of a lot of things like blood pressure, obesity, uric acid, and your waist circumferences. So these are the factors. But in case of people, these are 90% of the patient are essential hypertension, and they are caused like stress. Like nowadays, also increased history of blood pressure, maybe because of stress. Because nowadays life is very demanding in the not in the sense you have to, time is short, people have to travel sometime a lot of distance, and your work is demanding. You have to meet the deadlines, and you have to meet your targets. And for as a doctor, we need to satisfy a lot of people. So like everyone's expectation is more. So from himself and the counterpart also for the kids. So stress is building up. Stress lead to a lot of things. I'll sometime if I get a time to talk about stress. Stress is not just one thing. It affects your body in a multiple way. It makes your artery thicken, you increase your sugar, increase hormones level in the body, which contribute to this. And as I told you, there are people, and with the age, blood pressure chances become more. As you become older, your artery become thick, so the heart has to pump harder to push the blood, so the blood pressure goes up. What is blood pressure? Is basically resistance of the artery as the age become more. And there are certain races, like it's more common in blacks, less in whites. I don't know if that is what is there. And so these are, and in case of young and summertime, you don't find the blood pressure is not controlled in spite of being on medicine, following all the precautions. There should be what we call as a doctor a secondary hypertension. Secondary hypertension, see, there is an underlying cause rather than the just normal thickening of the arteries. They can be hormonal. Most hormonal, it can be from the kidney, or sometimes because of heart. So, and sometimes because of the hormonal problem, like gland problem. You might have heard about Cushing disease, Corn syndrome, or thyroid issues. There are glands in our body which produce hormone. which help in maintaining our blood pressure. Sometimes it overwork, it can hormone is produced more, so that can cause to high blood pressure. Or like there is some which help in more producing retention of water, so that can cause. There are some tumor also which can lead to production of these hormones, which can also cause this. And everybody know as the kidney is another reason. If you have a kidney issues, chronic kidney disease or acute kidney failure, it can also, or sometimes there is a thickening of the artery which supply to the blood to the kidney, can increase the blood pressure, because kidney is one of the most vital organ. If the blood supply is going down because of any reason, kidney is getting damaged, bodies try to increase blood pressure to maintain the supply of the kidney, because all the toxin in our body are mostly filtered by kidney and excreted of the body. Sometimes people who on some medicine like painkiller, who take unnecessary long medicine, it can cause oral contraceptive pill, and some medicine like steroid, because as I told you, the hormone which are produced from the body, that can also lead to the blood pressure. So, and see, this is like we talk about what is hypertension, we know high blood pressure, and what are the categories and what are the causes. And what are the common symptoms of hypertension? Everybody knows. We feel tired, fatigue, headache, neck pain. Sometimes we feel nausea. If it is too much, which we call high malignant hypertension, if blood pressure is very high, you can have dizziness, you can have altered sensorium, you can have weakness of the body. Then you immediately need to see the doctor. And so these are the symptoms. As I told you, silent and heart, as if blood pressure remain uncontrolled, so it can lead to the thickening of the muscle of the heart, which can lead to heart rhythm irregularity, breathing difficulty, short of breath, and that kind of thing also. So then the question comes, why we need to know. So I'll just increased blood pressure lead to lot of problems. Everybody talks about it. So I'll just mention like what is the number of chances, how much percent increase is there. Suppose somebody has a blood pressure is almost 6 times higher risk of having a stroke. What is stroke? Stroke is when there is a decreased blood supply to the brain. So that part causes, it's like heart attack. When there is a decreased blood supply or stoppage of the blood supply to a particular part of the heart, it's called heart attack. Same like there is a decreased blood supply or stoppage of the blood supply to the particular part of the brain, it leads to stroke. So hypertension, as a statistic says, there is a 6 times increased risk of having a stroke. And same like heart attack, they have a 3 times increase of having a heart attack. And you might have heard, or sometimes people complain of there is also, as I told you, as the blood pressure become high, the arteries has to become thick. Sometimes your arteries in the legs also become thick, and there is which need to sometimes, have you heard of, there's a gangrene or that kind of thing. There is a thickening of arteries of the legs, which can call peripheral vascular disease. And increased blood pressure is also can cause to kidney disease, because body has to be balanced. Okay, so what we talk about till now is blood pressure, what are the categories, what are the causes, and what are the complications. So what should I do? See, my take on this is this: there are always camps, health camp going around you. So always go to them if you get at least once in 6 months or once in a year. Why? Because these camps are aims to find out people who have a problem, like common chronic problem, like cholesterol problem, sugar problem, or blood pressure, because these are one which lead to multiple problems. These camps are very much designed. I have recently been to two community health camps. Then I found out I would be able, out of 50 patients, I could find out 5 people, they were having a high blood pressure which they don't know. So that is the point of having a health camp. And sometime maybe out of 50, 1 or 2 new people who have high blood sugar or cholesterol. So this is one thing you can do whenever there is a health camp. If you've not done any health checkup in last 6 months or 1 year, at least go and attend. At least you will be able to catch your blood pressure early. This is my take on this, because these are very, very important. And my medical life, I've done so many camps, so I've come to so many people. Almost 10% of the people who come to the camp, they've come to know their blood pressure is high for the first time. So that is the importance. So you should do the regular health checkup. What else you can do as a home? They said there are treatment called pharmacological or non-pharmacological. Non-pharmacological, what you can do from yourself point of view. The most important non-pharmacological, maintaining your weight. Your weight should be around BMI between 20 to 25. So your weight, which is how is BMI is calculated, weight upon height square. So your weight, you should try to maintain optimal weight so that the blood pressure will be better controlled. What else you can do? Avoid, as you know, everybody said, avoid fatty food. And most important is what you can do is avoid salt, or restrict your salt to 5 gram per day, 6 gram. So the common question I have, what should I do? Should I make my food without salt? So my take on this is try to minimize it. Don't add salt in your raw vegetable. Whatever being used minimal for cooking at home, that is okay. That is enough. Don't add more salt on it. Minimum salt you can add. Don't add salt to your yogurt. You don't add to the salad extra salt. And if you can add potassium rather than the normal salt, that is supposed to sometimes protect from the bad effect of the sodium. What else you can do? Exercise. How much? At least 30 minutes of brisk walk if we can do. Everyone should do 30 minutes every day. So that will help you to control your blood pressure. And avoid smoking. And alcohol. Alcohol should be limited. It should be less than 3 units per day for men and less than 2 units per day for men. So, and these are the non-medical part which you can do. First, control your weight. Do brisk walk 30 minutes every day. And reduce your sodium, and increase your little bit of potassium. And avoid smoking and cut down your alcohol. And eat fresh fruits and vegetables if you can do. They said 5 colors of vegetable and fruits. I don't know how many people are able to eat today 5 colors and vegetable, but it is very protective. At least take some fruits every day, fresh fruit every day. If you can mix 5 types of fruits, that will be good and healthy. This is the medical non-medical part. Another part is you should always follow with your doctor regularly, even if your blood pressure is controlled, because I've seen most of the patients, they take medicine and they continue. They don't come for the follow-up. If check your blood pressure every regularly, and 6 months or 1 year at least see your doctor if your blood pressure is controlled, because he might need to do some tests, like common tests, so there is no damage on kidney, there is no heart effect on the heart. So follow up with the doctor is very, very important, especially if your blood pressure is not controlled, or even if it's controlled or for some time, because it's very important to, as long as possible, to live a healthy life. So as a doctor, we will make you understand how much is to be, and over the time we might need to change the medicine or add more medicine, and if any side effect comes up, we can modify the medicine. So I'll tell you like few medications. Some medicine sometimes After starting medicine of blood pressure, some people get swelling in the legs. So they said, no, I'll not take it. So there are side effects. Sometimes this one can be the side effect of the medicine. So if you go with the doctor, they can modify and change the medicine and tell you what to do about it. It's like sometimes people feel having more urine, so maybe it's the effect of the medicine. So most important is know your BP, try to maintain as much possible, control it, and it's very important for healthy living. And even the World Health Organization want to reduce the incidence, which is, I told you, around 50% of the people are affected by blood pressure, and which they don't know, to reduce to around 30%. So that's why we celebrate every year May 17th as a Hypertension Day. And as a call doctor team, we are always here to help you to understand and guide you, and if need any kind of services, monitoring of blood pressure, how to do that, we can definitely help you. So here what we learned today is about blood pressure. What are the optimal range, what are the common symptoms, what are the cause, and why it is important for me to control my blood pressure. It's very, very important, because if somebody have a stroke, it affects not only one person, it's increased burden to himself, and for the family it become very difficult, and to the society. The most important is himself. You are like I and you are running just to have a good and healthy life. We don't want to have any problem in our life. Same like heart. Heart is very, very sensitive, and like brain, they don't give you time to this. So hope I am able to tell you something about this, and you follow with the doctor is very, very important. Blood pressure every 6 months, 1 year you should do blood test for the kidney, cholesterol, and heart, because sometimes they need to do a echogram, sometimes they need to ECG just to maintain it the must. Anyone want to ask something? So I'll end my session today for hypertension. If anything we can help you, you can message us or our Instagram or Facebook. So we'll be there to help you.